welcome everybody. And thank you for joining us for our webinar on home tonometry. My name is Elena Sturman. I am the President and CEO of the Glaucoma Foundation. Since our founding in 1984, the Glaucoma Foundation has worked to encourage and support basic and applied research in glaucoma with the goal of preserving and restoring vision. Over the years, we have provided millions of dollars in seed money to scientists for innovative projects, and we continue to hold a space for them to think creatively and gather the data they need to pursue major grants from NIH and NEI. Above all, TGF is dedicated to improving the lives of people with glaucoma. In most glaucoma, your doctor will be concerned with your intraocular pressure, IOP, because high IOP can lead to disease progression. Monitoring and reducing IOP is a foundation of glaucoma treatment. Today, Dr. Barbara Wirostko and glaucoma patient Rebecca Vilender are going to talk about benefits of measuring your IOP at home and how you can access an affordable home monitoring device. Dr. Wirostko is a board-certified practicing glaucoma specialist holding a clinical adjunct professor position at the University of Utah and in the Department of Ophthalmology and Department of Biomedical Engineering. She is a serial entrepreneur, a strategic executive on ophthalmic drug development, and she is currently the Chief Medical Officer and co-founder of Claris Bio, a VC-backed biotech startup looking to develop ophthalmic therapeutics for unmet medical needs. She also sits on several prestigious editorial boards, has published and written numerous peer-reviewed papers and books, and serves on a variety of advisory boards and grant review committees. And she holds fellowship positions with Association for Research in Vision and Ophthalmology and American Academy of Ophthalmology. She has been invited globally to lecture on exfoliation glaucoma, which is her area of clinical research expertise. Dr. Wirostko is also a member of the Scientific Advisory Board of the Glaucoma Foundation. Rebecca Vilender is a senior manager at the IT consulting firm in Minneapolis. She has had juvenile glaucoma for almost 30 years, and her glaucoma specialist recommended that she use eye care home to gather better data on her IOP. Rebecca is going to tell us more about how the information she gathered has impacted the treatment plan. We also look forward for Q&A with our audience. If anybody has a question for Barbara and or Rebecca, please type it into the chat button and we will do our best to get to it at the end of the talk. Barbara, Rebecca, welcome. Let's begin.
Thank you so much, Elena, and thank you to the Glaucoma Foundation. It's been a pleasure to be a member of your organization, and I really applaud you for working so hard to educate physicians and patients. So with that, I'm going to share my screen, and I hope everybody can see it. So today I'm going to talk about the value of home tonometry and give you a little bit of background as well as what I have been experiencing personally as a physician and clinician. My disclosures are, as Elena had mentioned, I have an academic appointment at the University of Utah Moran Eye Center. I also am the co-founder and chief medical officer of a company called Claris. And then I've started and work as the medical director at myeyes.net. There we go. So glaucoma is a chronic progressive optic neuropathy, and I really want to focus on that chronic aspect. We look to manage it, we can't cure it. We also know that IOP is still the only modifiable risk factor. We are aware that there's other variables that can affect IOP and also affect glaucoma progression, such as perfusion, ischemia, inflammation, etc. But the tools in our toolbox are really still focused on IOP. We also know that greater fluctuation in daily IOP and over time is associated with worsening. And this comes from our randomized clinical studies that really go out over years. These clinical studies have showed us and demonstrated that if you lower IOP, you can slow down disease progression. And we always manage this disease by identifying the highest IOP. As patients, many of you know you've been asked, how high is your IOP? What was your maximum IOP? What was your IOP prior to starting treatment? So we still diagnose and manage through that number. Diurnal IOP and nocturnal variability has fluctuations, and we know that it fluctuates due to positioning. If you're lying flat during sleep, time of day can affect your IOP. We also know cortisol levels, stress, meditation can help reduce your IOP. Nitric oxide lowers IOP, and exercise, yoga, can actually help also, except you don't want to be inverted because that can actually elevate your IOP. And it's crazy to think that based on this amount of fluctuation, that we still, as clinicians and as patients, you come in, every 3 to 4 months, and there's a single time point during that office visit where your IOP is measured. And it's measured over a couple of seconds, but yet there are 31 million seconds in a year. So that IOP measurement is a very small reflection of what your IOP is actually doing over the course of time. We also know that glaucoma progresses despite managed IOP. And this is how I got interested in learning more about home tonometry. It was actually a patient of mine, my co-founder, who actually was the one that introduced me to the eye care home and really taught me about glaucoma management. So it's a chronic disease with variability. And I always go back to the fact that it's very similar to diabetes and perhaps even hypertension. And we know that if we measure glucose chronically over 24 hours and over time with hemoglobin A1C, that we have better control over that number and less disease progression. There are some devices that are actually being evaluated, and some of them are actually even approved. So the Triggerfish is a continuous monitoring system, and I focus on continuous, and we see it there in the upper left-hand corner, and it sits on the cornea. It's a contact lens. It doesn't measure IOP, but it interprets the corneal dimensions that are then translated to an IOP measurement. The eye care by implanted data is an implantable microsensor that performs continuous monitoring of IOP in glaucoma patients. It's currently in clinical studies. It actually did recently receive a Europe CE mark, so it is technically cleared or available in Europe. It's not yet available here in the United States, but it does require surgery for implantation. And thirdly is the eye care home tonometer, which was cleared in the US and in Europe. It's based on rebound tonometry. And most of you are probably familiar with the handheld eye care tonometer that your doctors may be using in the office. It's the same rebound tonometry that we use. So the eye care home, we've come to accept and use rebound tonometry in preclinical studies. In fact, the FDA relies on this methodology to actually approve drugs and use it for safety measurements. And we also use it in our offices. It's a validated method of collecting IOP with good reliability, and it also has fairly good approximation with Goldmann tonometry, the gold standard. The eye care home has similar IOP measurements as office-based tonometry, and these studies have been done, again, trying to validate and actually show that this is a reliable, sensitive, and specific method that you can use at home. Currently, a device that can be easily used at home by patients. These are two photos of the eye care tonometer, and you can see on the bottom lower left, this is the original eye care home that was cleared in 2017, and it was approved or cleared by the FDA as a prescription device. So again, this is not something you can buy over the counter. It requires a prescription by your clinician, and it's intended as an adjunct to routine clinical monitoring of IOP in adult patients, so anyone over 18 years of age. And that really has to do with the shape of the eye and the forehead and the face and the structure of the face. And you can see on the bottom that there's this little probe that comes out in a millisecond, touches the cornea, rebounds off the cornea, and then interprets the IOP. And it's very objective. It's not subjective, meaning that the machine does all the interpretation and also tells you whether or not it's a good reading. On top, above that in the middle, is the iCare Home 2. So this is the newer device that was actually cleared in 2021. And I always wondered, with this device, how should we be using it? Should we be using it as a diagnostic tool for short term? Or should we actually be using it as a long-term monitoring tool? And Becky, who's graciously agreed to be here with us as a patient, will talk to that. So some of the differences between the iCare Home original and the iCare Home 2 is the batteries, the battery system. More friendly with the iCare Home 2 is alkaline. You can also take your measurements reclined and supine. And this is important, again, if you're looking to determine if during the night or supine is actually elevating your IOP. The connections are easier with the Home Care 2 with Bluetooth, and you can actually use it with the Apple or an Android device. It also has an active positioning light, green light, that helps you center it. And it also tells you if the information is inaccurate because it wasn't centered correctly. Both instruments work very, very well. And I have patients that actually use both or either one. So what's been the value of home tonometry for me? Well, I've been using it initially as a diagnostic tool. When I have a patient present to my office, I want to know what is the highest IOP. And often I have found that that IOP is not during the clinical hours. So in patients, especially who are progressing or who I fear may progress, I will advocate for them to use the iCare Home for a week and use it at all times of the day and even in the early waking hours. And I've also found that not every patient responds the same. The other thing too is if I find that a patient is actually spiking quite high, that helps me determine my next steps. And often what I have found is I'm not bringing the patient back for another visual field to confirm damage or change. I'm looking at their nerve and I'm saying, your IOP is way too high. This pressure is too high for that nerve. And I usually send them to my surgical specialist much sooner. My patients actually have taught me that this is a great monitoring tool because over time, again, this is a chronic disease. The other thing many of you have probably seen is that drops perhaps stop working as well. Surgeries may stop working as well. And even lasers may lose their efficacy. Recently, I had a patient where I put the Durista in and he travels, he doesn't live locally, he travels for work. And he was able to tell me with the iCare Home that his pressures were slowly creeping up, which told me that his Durista was wearing off and I needed to call in a prescription to him. And again, this was done virtually. He didn't have to come to my office for me to check his pressure. And I thought that information was really valuable. This is a study that was recently published out of Hopkins, and this was from Dr. Tom Johnson and colleagues, McGlumphy, Alyssa. It was 107 eyes of 61 patients were analyzed. And what's fascinating here, and this is what I've been finding with my patients, is that there were a majority of patients who were spiking between the hours of 4:30 a.m. and 8 a.m. And the mean daily maximum IOP exceeded that clinic IOP in close to 50% of patients. What we called these spikers were tended to be younger age, male gender, and also did not have filtering surgery. We have found that filtering surgery and certain surgical procedures really help with that spike. Their conclusions were that self-tonometry provides IOP data that supplements in-clinic tonometry, and this type of measurement would not be able to detect these daytime clinic over daytime in-clinic diurnal curves. So again, the ability to find these spikes outside of the clinic. This is one patient that was in the paper. And again, just to illustrate the point. So this patient had reproducible elevation in IOP to between 17 and 28 each morning between 6 and 7 a.m. in the morning. And here you can see that this is over 1 week of duration. And again, this is generally what I have my patients do is they use the instrument for about a week. And we have found that that's pretty good at picking up these spikes. And you can see that as they went into the afternoon hours from 12 o'clock on, those pressures came down into the low teens, but yet they were having these spikes. This is another case that was published out of Rojas in ophthalmology. This was a 72-year-old surgeon with exfoliation glaucoma, and he averaged IOPs, and again, up on the top with that blue arrow, you can see what his IOPs were during waking hours. So in the clinic hours, he was running in mid-teens, maybe he spiked a little bit to the low 20s, but actually at night in that left eye, he went as high as 43. So they changed around his medications, and that was what this case actually showed. And the difference between the other one was another case 2, with basically the same. There was a spike that was noted, and they added additional medications. Information on surgical intervention. So this is a gentleman who suffered from what I called controlled normal tension glaucoma for 30 years. His IOP on average was 12 to 14 millimeters of mercury in the office and on maximum medical therapy. History of sleep apnea, which we also believe may be adding to these IOP spikes, but that data is yet to actually be determined. That's my hypothesis only for various reasons. He also had hypertension and he had SLT. He had very good vision, but he had advanced visual fields. And this is a photo of the visual field. So again, for my clinicians on the call, you can see that these were fairly advanced. He was able to get the eye care home. He actually purchased it himself. And in blue are his measurements with his eye care home. In red, and this is a case is actually being published in JAMA shortly. These red dots are the clinic measurements. And you can see, again, the variability with the eye care home and the extremes in IOP measurements. So we're getting pressures in the 20s down to the 10s. He had a hydrus. And again, this is what's fascinating. The hydrus didn't lower those spikes. It did not flatten those curves. Then he was able to actually go up to IGOMED in Canada and get a PreserFlow in that right eye. And immediately you see that that IOP has been, those spikes have been flattened. Lastly, surgical intervention. So this is a case that was shared with me from Dr. Jitham Johanna, and this was also accepted and published now in ophthalmology glaucoma. A 37-year-old male with uveitic glaucoma who complains of intermittent headaches. In office, he's got high teens, low 20s. With the eye care home, he's got fluctuations upwards of 45 plus. The patient underwent a GAT procedure, a gonioscopy assisted transluminal trabeculotomy. In red is his IOP in his right eye before the surgery. Sorry, blue. In red is his IOP with the eye care home in his left eye before surgery. And then in green is after the surgery. And again, he responded phenomenally well to that GAT procedure. And with this type of home tonometry, this patient will be able to see if this surgery now lasts. For my clinicians on the line, there are reimbursement codes. So remote patient monitoring, after COVID, we've really found that we can do a lot virtually. So if you have a patient that actually is recording their data month to month and they send you the printout, you can actually bill for that remote monitoring and just document the amount of time that you spent. And there's different stipulations with each of these, whether it's 20 minutes, whether you've spoken to the patient or the caregiver, or if you just documented any changes. But again, if anyone is concerned about being slammed with a lot of data and information, you can bill for it. So the usefulness of this is really adding this to a telemedicine workflow. But for me, it's been finding out if my patient actually is spiking. It's allowed me to determine how they're responding to surgery and or laser to really know if my treatments have been effective. It's also helped me determine if medications have been effective or ineffective. And it allows me to make changes to the medications. Because again, I'm looking at that top IOP number, which is what we're always learning to target, right? It's that peak IOP. You look for a target pressure lower than that peak IOP or that target IOP. The other thing that's really cool is, again, it's really helped me see the tail off and the tapering off of some of these sustained IOP lowering devices and inserts that are now going to be available. It's been eye-opening, quotes, that it's really the early AM hours. I'm working with my colleagues, both at Hopkins and at other institutions, as well as the Moran, to try to find out why it is the early waking hours. So stay tuned. We're trying to learn that. And it's also enabled me to detect that spike, which I believe may be helping to slow down progression in my patients. Why did I start myeyes.net? I like to say that it was started by a patient, a physician, and a technician, because we felt it was really important to get this information out to patients and make this device available to patients, not only as an acute tool to look at a week or two, but also for patients who want access to it, who want to purchase it and then use it long-term to basically monitor their progression. The other thing that I'm very, very happy to say is this device is expensive, but what I'm happy to say is that working with the Glaucoma Foundation and Elena, we are working to put in place a mechanism that patients who have financial hardships and challenges can get access to this device. So stay tuned for that. Elena will keep you posted if you are such a patient. But again, we do not want finances to stand in the way of medical care. And with that, I want to thank everyone. And I know Elena will ask for questions after, but I will turn it back to Elena. Thank you.
Perfect. Thank you so much, Barbara. Fantastic presentation. So now it's the time to hear from our patient who is with us today, Rebecca Vilender, and she will tell you the importance of home tonometry from a patient point of view.
Hello, everyone. My name is Rebecca Vilender, and I'm going to share how I worked with my doctors and used the iCare Home device to first understand why my glaucoma was progressing, and then to understand how effective my recent surgeries were. So I will start with my glaucoma history. Next slide, please. When I was in my very early 30s, I needed a new pair of glasses and went to see my optometrist. He expressed concern about glaucoma because my eye pressures were quite high. They were 25 and 26 at that young age. I didn't even know what glaucoma was. None of my family members or any other relatives had glaucoma at the time. My father was diagnosed with glaucoma 15 years after my diagnosis. He says that he inherited his glaucoma from me. I have been diagnosed with juvenile glaucoma, which can be more rapidly progressive with higher IOPs and a greater amount of diurnal fluctuation. My right eye is significantly worse than my left eye, and the doctors don't really know why. My left eye is nearly normal for my age on Vyzulta eye drops alone. And I have basically been fighting for my right eye over the last decade. A key message that I want to share with all of you is that even though I have had a difficult glaucoma case for many years, I still do have full visual fields. And glaucoma is a very treatable disease, especially if it is caught early, as mine was. And I have a lot of hope that I will retain my vision throughout my lifetime. Next slide, please. This timeline shows major events in my glaucoma history. I do want to call out that the events and timelines are not true to scale. For example, the first blue arrow representing stability for both my right and left eye is a short arrow, yet that time frame was 16 years. I was very stable for 16 years with eye pressures in the very high 20s, and I was told my eyes could withstand high IOPs. And I didn't have any problems really until 2011. In 2011, I was on several eye drops and my glaucoma was progressing in my right eye really fairly rapidly, despite eye pressures that went down from the high 20s and even a few readings in the low 30s to the mid-teens. I was very scared at this point. I was still quite young, and even though my IOPs were lowered significantly, the treatment didn't really seem to be working. I went to see Dr. J. Katz at Will's Eye, and he suggested that low blood pressure could be causing my issues with glaucoma progression, ocular perfusion pressure being low. I was switched to a new treatment regimen, and then I had over 6 years of almost 100% stability, as you can see by that line, that next blue arrow in the middle of the chart for my right eye. Then my IOP started creeping up again in late 2018. So I had SLT surgery on half of my right eye. A year later, I had SLT surgery on the other half of my right eye. I thought that I was good and felt lucky that I had had this second SLT surgery at the end of December 2019, which was right before COVID started in the winter of 2020. However, I was wrong. I was not fine. You can see that in March of 2022, I had MIG surgery, or minimally invasive glaucoma surgery, and I had 4 eye stents injected into my right eye without cataract surgery. This surgery is called the iStent Infinite surgery. It typically includes 3 eye stents, but my doctor told me that if he had my eye, he would want 4 eye stents, so I got 4 of them. Next slide, please. With all of the problems in my right eye, I do want to call out that my left eye has been almost completely stable during that entire time, which is very reassuring. On the prior slide, the second red arrow with rapid progression in my right eye was during COVID. My right eye has really been an incredible fight. I did go in regularly for IOP checks during COVID throughout all of 2020 and 2021. And my IOPs were in the low 20s in my right eye at every visit. Historically, I have not progressed with readings in that range. However, I didn't do all of the standard testing during COVID, the visual fields or OCTs, because I didn't want to sit around the office before the vaccines and N95 masks were readily available. It can sometimes take several hours to go through all of those tests, and I just didn't want to be sitting around the office. So just once in the 27 years that I've had glaucoma, I let my guard down a little bit, and I did have major damage to that eye. So I learned about that damage in October 2021 when I had an OCT test after 21 months. And my glaucoma, I didn't really know why, because all of my readings had been low, and yet I had a significant amount of damage. My glaucoma specialist recommended that I get an eye care home device to monitor my IOPs around the clock to see what was going on with them. So I rented an eye care home device through the My Eyes organization, Dr. Barbara Wirostko's company that she mentioned earlier. And I rented that device and learned from using the eye care home that the IOPs in my right eye were fluctuating by over 20 millimeters of mercury in one day. And they were reaching maxes in the low 30s almost every day. So this data was so valuable that I ended up purchasing my own eye care home device so I can check my IOPs at any time. Next slide, please. So this is what my initial data from the eye care home tonometer looked like before any 2022 surgeries. Now, I have to say that I am a math major and my husband has his degree in statistics. So we went a little overboard on some of this data. I collected 760 measurements overall and across a number of different scenarios, and over 200 measurements were collected for this first graph before any surgeries. This is maybe a record amount of eye care data, I'm not sure, but we collected quite a bit. My right eye is the orange line and my left eye is the blue line. I found that my IOPs go very low at night, but then very high starting in the early mornings around 7 a.m. They are then lower again in the afternoons, but go higher around 5 p.m. at night. When I was going into the office during COVID, I was going in those afternoon hours. So you can see even my right eye that goes up to the 30s almost every day here would have been in the low to mid 20s, which has been always good for me. So it wasn't caught. But clearly every day I was having readings up into the 30s. And I found that when I used the iCare Home. So the iCare Home was very easy to use, even during the night. I would wake up naturally during the night. I went to our study and used the iCare Home. There was a lot of beeping involved because my eyelids always were trying to close during the night. And the device tells you if it can't get a good reading. But that would wake me up. And then I was able to get all of these readings that you can see here. So again, if you look at this is before any 2022 surgeries. You can see that in my right eye, my maximum IOP was 31 before I had any surgeries. Next slide, please. At this point, my doctor knew that I needed surgery on my right eye and first did a repeat 180-degree SLT on that eye. And I could see with the iCare device that it didn't really work well enough for me. So I was able to quickly proceed with treatment and get the 4 eye stent surgery to try and stop or slow the progression in my right eye. And this graph shows the data collected from 3 scenarios in my right eye. So the first scenario is the purple line is before any surgeries in 2022. So that matches the orange line from our prior graph that I just showed you. The blue line is my eye pressures that were taken with the iCare Home after my SLT surgery. Now this, you can see that it didn't work that well for me. It was taken a month after my surgery. And with my prior surgeries after a month, I had had a significant improvement. It was my third 180-degree SLT on my right eye. So it was a repeat. And I've been told those don't always work as well. But it was pretty clear that I needed additional treatment. And I could see that pretty quickly with the iCare Home. The green line is after my 4 eye stent surgery. And I waited 8 to 9 weeks to collect data after that surgery. And if you look at the table on the left, you can see that, again, before surgeries with the purple line, my IOP was going up to 31. And after I had the 4 eye stent surgery, my eye pressures were going up. My peak was 21. So it really had quite an impact on my IOP by getting those 4 eye stents. And I was happy to be able to see that, gathering all these hundreds of measurements using the iCare Home device. So I felt confident that that surgery had worked pretty well for me. Next slide, please. This slide shows the averages of my IOP for my right eye across the same 3 scenarios. And I'm really thrilled with the results of the 4 eye stent surgery. I know it is still too early to claim success and stability because I just had this surgery in March of 2022, but my OCTs do appear to have stabilized, and it appears the progression in my right eye has greatly slowed down or perhaps even stopped again. So I feel confident with the treatment that I'm receiving at this time. And because I have all this data, I feel like I know that everything has been measured accurately because I can see that I haven't had any peaks up into the 30s and I've taken hundreds of measurements. I also know if I do have another problem, I should be able to catch it right away, which is critical for me now because I had so much damage during COVID that my doctor told me that additional damage would likely result in visual field loss. So I really need to be careful with my right eye. And by using the iCare Home, if anything changes with my IOPs, I know I will catch it very quickly. Next slide, please. So I would like to close with some recommendations for using the iCare home device. If your glaucoma is progressing despite treatment, gathering data with the iCare home device can provide you and your doctor with 24-hour IOP measurements that could greatly impact and personalize your treatment plan. The device is very easy to use once you have proper adjustments for fit. So I would recommend working with your doctor to set those adjustments. I have the original iCare device, and it came with a whole bunch of instructions and lots of videos of how to adjust it. And to be honest, I didn't read all of those instructions, and I just started trying to use it, and it was beeping at me a lot. So it was a little tricky initially, but then I figured it out and got the fit adjusted just right. And I felt confident that I was safe using the device, because it beeps if something isn't exactly right, if it isn't the right distance from your eye, or if anything else isn't right, if you're not holding it at the right angle, it will beep at you, and it won't take the measurement. So you know that you need to fix something. And also you cannot feel it when it touches your eye. So throughout all those hundreds of measurements, you really cannot feel it at all. There are two options for viewing your IOP readings. The data can be uploaded to the iCare server via the Android phone that is sent with your rental. This is with the original iCare home device. I know with the iCare 2 device, you can also use an iPhone, which I really wish that I had that iCare 2 device, but I figured out the Android phone. So you can send all the data up to the iCare patient portal and look at it yourself and do your own graphs and analysis, which is what I did. Or you can have all of your data uploaded, and there are some iCare system graphs that you can view, or have just the data sent directly to your doctor without your involvement. And I would recommend considering the second option. If you have a problem and you're just trying to figure out what's going on, I would recommend having all the data sent to your doctor, because I do want to call out that it can be distressing when you're using this home device to see high readings. So after my SLT surgery, I waited a month and I took these readings, and I saw a lot of high readings. And it was just depressing to know that I had gone through that surgery, and it appeared that it didn't really help me enough, and I was going to need yet another surgery. So after I had the 4 eye stent surgery, to be honest, I was kind of scared to look at my data, because what if that surgery didn't work? Then were they going to tell me that I needed yet another surgery, and what were they going to want to do to my eye then? So I actually didn't even look at it until I was in my doctor's office with my doctor, so he could help me if there was a problem, interpret the data, and talk about next steps. And in my case, as you know, my data looked really good after my 4 eye stent surgery. So when I was with him then, I was really excited because it looked so good. And so I was happy, and then I created all these graphs that you saw. So I would recommend that you think through that, because there is some distress if you look at these measurements yourself and you don't have your doctor to reassure you. So that is, I guess, my history with the iCare home. And with that, I'll turn it back to Elena.
Thank you. Thank you very much, Rebecca, and thank you, Barbara. Fantastic, fantastic presentation. So we have a bit of time for our questions and answers, and I see that we have some questions. So I will start reading them, and I think you will know who they directed to, but the first one is for you, Barbara. Unlike prices for iCare 2 range from $1,500 to $3,000. Do you have a recommended vendor?
So iCare, this is the reason why My Eyes was actually formed and partners with iCare, because iCare cannot sell the device to patients. So as in my patient's case, he had a really hard time actually accessing the iCare home. And that was why we started My Eyes. So we would be one of the vendors. There is another company out there that is also selling it. But yeah, there's not many of us.
Mm-hmm. Thank you. Thank you. Next question, also for you, Barb. What is the physician supposed to do with all the IOP measures? Since you don't know why the IOP is higher in the AM, how do you treat it?
So we approach it, and I approach it as any elevated IOP. So whether it's in the AM or during the afternoon, if you came to my office and your pressure was in the 30s, I would change around your medications and or recommend surgery. So it's the same treatment. It's just uncovering something that we previously did not know because we didn't have access to that information. So it doesn't change how we respond to high elevated IOPs per se. It just allows us to learn more about that patient's IOP.
Thank you. Thank you. Rebecca, next one is for you. When you say eye damage, how was it measured and how did they know your eye was damaged?
Well, they knew that I had structural damage through the OCT scans that were done. And so they tested, my OCT has been historically tested every 3 to 4 months. And they could see, since I didn't get tested during COVID, it went for 21 months, but I had a very large drop in the average RNFL, retinal nerve fiber layer thickness in my right eye. So it was substantial loss of thickness over that time period.
Thank you very much. Thank you. Next question is for you, Barb. Is the iCare Home 2 more accurate in measuring IOP than version 1?
So actually, no. So they're both equally sensitive and specific, and they've both been validated. And the other vendor, just again, to be completely fair to everyone, is Digital Glaucoma. That's the other company that's out there, besides my eyes.
Thank you. Next question. How are the patients supposed to find out about measuring IOP at home?
Well, I can answer that in my case. My doctor suggested a couple options. One was the device that Dr. Wirostko mentioned, where you actually have something injected into your eye, and the other was the iCare Home device. And so I was more interested in using the iCare Home device. and I did have a little bit of a challenge figuring out how to get one, to be honest. And then I learned about the myeyes.net option and was able to rent one, and then learned so much that I purchased one through myeyes.net as well.
Thank you very much. Next question. For iCare Home 2, is the data hosted on the iCare site so that a subscription annual fee is necessary?
So currently there's no subscription annual fee. That is something that iCare may institute. It depends if you rent or own it. So if you rent it, then we actually, or My Eyes actually owns the device. So then we have the access to the data and then supply it to you and your patient. You and the physician. If you own the device, then you actually have access to all the data, and we're removed from that process and it's available on the cloud, correct?
Thank you. Thank you. Next question, and I guess it's for either Rebecca or Barbara. Rebecca, as a user, probably you could answer this one. Is this device self-administered, or does it require a second person to measure your IOP?
No, I could take all the measurements on my own. And like I mentioned, it was a little tricky to get the adjustments done. So I do recommend doing those with your doctor. How far apart or how far away it needs to be from your forehead and your cheek, which is individual for every patient. But once you get those adjustments and you know what those numbers are, you can just turn them on the device and do it yourself. And it's super easy to use.
And I had actually one patient that was severely visually impaired in one eye and also had a hard time hearing. So he couldn't hear the beep. And when he went to look at the device and center it, he couldn't see it well. So his wife did help him with it, and he was able to get really very accurate and really good information that allowed us to change his medical management.
Thank you. Okay, we have series of questions from an attendee, so I'll try to get to most of them. Have purchased the device on my own and looking forward to using it. Have a few questions. Will sleeping with raised head reduce the IOP in those 5-7 a.m. hours?
What is that? Sorry.
Sleeping with raised head.
Oh, good question. We don't know. I think, what, as I always say to my patients, you guys are teaching us, you're collecting data and finding things out that we never thought about. You may find that your pressure changes depending upon what side you sleep on. That's been reported in the past and published. And I have one patient actually who did find that out to be true. The side he slept on was always the eye with the higher pressure in the morning. But we don't know.
For Rebecca, how frequently do you use this device? 20 measurements every day or 20 measurements once weekly?
Well, to be honest, I used it extensively when I was having this problem and before I knew that my problem was resolved. I have, what I've been doing is probably using it once a month and just collecting a lot of data over a week and taking a look at that data to make sure that nothing really changed. But I haven't been using it every day. I haven't been using it every week. But I have been, because I have gone to the doctor and I'm confident that I'm stable, and I figure if I use it every month and look at it, that's probably good enough. And it, for me anyways, and it probably would be better to use it more often. I've just been busy. So it's hard to always have that on the top of your mind, especially since I am thinking my issue was resolved. But so I've been using it probably once a month for a lot of measurements over a week, and then I just look at it. So
thank you. Next question is for Rebecca as well. What were the names of the surgeries that you had? You mentioned SLT, but what were the others?
Well, I had 3 180-degree SLTs on my right eye, and then I had 4 eye stents inserted in March of 2022. And it was really the 4 eye stents that made the difference in my IOPs, which is called the iStent Infinite surgery because I didn't have cataracts. Like I said, that usually is 3 eye stents, but my doctor said, if I had your eye, I would want 4 eye stents. And he said, I think I can get 4 of them in there. And so I was like, well, okay, I guess I'll get 4 of them then. So that was it's called the iStent Infinite surgery, but I happened to get 4.
Thank you very much. Thank you. Barbara, next question is for you. You mentioned in one of your slides that you were working on insurance. It's not exactly that, but you can respond to that.
So currently, the majority of insurance plans will not cover it. However, insurance will cover different devices for chronic diseases. So it's something that my eyes and the eye care team is actually trying to work on to learn more. You can put it through flex spending or a health savings account. And we have had 1 or 2 patients actually get reimbursed from their insurance company. So it's always good to ask the question.
Thank you. Thank you. The next question it could be answered by either you, Barbara, or you, Rebecca. Is anyone using the data to pinpoint positive or negative activity as it relates to IOP? For example, pinpoint a specific exercise which is helping lower IOP.
So, and then I'll have Rebecca chime in too. So I have a lot of patients that collect a lot of data to try to see what influences their IOP, whether it's exercise, diet, sleep habits. But yes, you're absolutely right. I mean, it's this is a large area of learning. We do know that exercise, there's been papers written on meditation, exercise, different things that can impact it. And what I'm also finding is that every patient's different. It really does come down to a personalized medical approach per patient.
Thank you.
I can say I've had a couple cases that I've thought, well, I wonder if this would be impacting my IOP. And so I get a lot of migraine headaches and took some of my migraine medicine, and I thought, I wonder if this is making my IOP go higher. And so I could test it after I took the medicine, and there was really no change to my IOP. So it increased my comfort level that, okay, this isn't causing me any problems with my eyes. It's not going any higher. And I also have thought, I wonder if when I'm under a lot of stress, if my eye pressure is going really a lot higher. And, I've had a couple cases where I've thought, all right, I've really been under a lot of stress over the last couple days. I'm going to try, and measure my IOP. And again, it hasn't been any different. So the couple times that I've thought maybe something would be impacting my IOP, I've been able to test it and it really wasn't impacting it at all. It just kind of, had its own diurnal curve and needed to be addressed with the surgery. So the things that I tested, I did not see impacted it. That's not to say that there aren't some things that are, but I haven't seen it yet with my testing.
Thank
Yeah, I have
you.
a lot of patients that will look at sleep habits and also blood pressure levels and try to correlate, especially if they've had like a 24-hour halter because their blood pressure is going down or going too high. And or as Rebecca said, also, stress-related events.
Thank you. Is there a learning curve with successfully being able to use eye care yourself? And what is the learning curve, if there is one?
I think I definitely got better at it over time, but just slightly. So it was pretty easy to use, but then just over time, I was able to do it quicker and get less beeping. And I'm not quite sure what I did differently, but just something that I must have been more used to it over time. But it was maybe an improvement of 10%. It was pretty easy to use from the start, to be honest.
And if patients have any issues or, challenges trying to use it, both my technician or the technician that works at my eyes, Chris Epperson, has been fantastic with helping patients, doing a Zoom call and showing them how to use it. And then there's also tons of videos and tutorials, as Rebecca mentioned, that are available, but it's pretty easy. I think I would definitely say I've got, again, I think my patient who was elderly with, visual impairment and hearing impairment was able to use it with the help of a spouse and, got some good measurements.
Thank you. Does the device require maintenance?
No, although sometimes the probe, so you're going to get reusable probes. You don't necessarily need to use a new probe every time you take a measurement because again, it's not like it's going between people. But sometimes that base can actually loosen up where the probe is. I don't know if Rebecca, if you've had any problems with the probe being inserted and you've had, like you said, hundreds of measurements.
Hundreds, yeah. No, I did have to get some more probes because I was really careful about changing it, especially after my eye stent surgery. I, wanted to make sure my probes were all,
Sterile.
sterile. So I did have to get more probes. But other than that, I haven't had any maintenance required.
Thank you.
But I got mine back in December. So it has only been, 9 months. So.
They're very durable. There was another question in the chat, but around maintenance or how long does the devices are very, very durable. They're very, simple in construction, very compact. There's not a lot of, widgets and buttons and things like that can fail. And yeah, we really haven't had any that ever had issues with working.
Thank you. And I would like to end the Q&A session. It was not a question, it was a comment, and it was a comment from the board member of the Glaucoma Foundation who said that he is very, very grateful to both Barbara and Rebecca for sharing this very valuable information. And of course, I would like to echo my thanks to both Rebecca and Barbara for sharing their knowledge. And of course, everyone in the audience for joining us today. I hope and I think we'll have a better understanding why additional IOP monitoring could be so valuable. There was a question in the chat whether the webinar was recorded. It was recorded. It will be available on Glaucoma Foundation website in a few days under the events tab. And that concludes our webinar today. I thank both of you so much, and I thank our audience, and I hope you have a good evening. Thank you.
Thank you.
Thank you. Thanks, everyone. Bye.